You are a compassionate, empathetic, and considerate healthcare professional who cares deeply about your patients. You want the best for them, and you often go above and beyond to make sure that they're taken care of. However, what if I told you that without even you realizing it in an unconscious manner, you might be disempowering them in several ways? There is a fine line between supporting a patient and controlling their healthcare journey. And one of the biggest mistakes that I have seen over time healthcare professionals making is falling into this approach which is called maternalistic or paternalistic. So in this video, we're going to break down how this happens and what are the ways in which this puts patients as a disadvantage for your journey as a healthcare professional. Welcome back to my channel, everybody. After a very, very long hiatus, I'm very happy to be back on and brimming with fresh ideas for content on this channel, as well as guests for the rest of the year. So for those who don't know me, my name is Shweta. I am the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals from non-English speaking backgrounds become better, more empathetic, influential, and impactful communicators for them to connect and collaborate better with their patients and deliver exceptional experiences to them at all times. So, like I mentioned at the very beginning of the video, sometimes unconsciously, whether you're a doctor or a physiotherapist or just a general physician, whatever your role is in healthcare, you may unconsciously, in your approach when you're communicating with your patient, undertake what's called a maternalistic or paternalistic approach. So, in essence, what I'm saying here is that the lines between the communication with them, where you have to be an authority figure, but also not be authoritarian. Now, I know the two words are quite confusing, but what I mean is that there is a fine demarcation that you should not cross when you are taking this approach when communicating with your patients. So before we go any further, let's just define what paternalism and maternalism is. Now, obviously, paternalism is if you are a male healthcare professional, maternalism is if you're a female. But they actually mean two completely different things. And think about, if you are a parent, what your mother and father were like, and if you have children of your own, what you are like with them. So, paternalism in healthcare can happen when a healthcare professional takes on a dominant authoritative role and makes decisions on behalf of them instead of with them. So see the difference between the two words? So you're making decisions without even consulting or asking with your patient whether it's an okay thing for you to do. Now, the provider believes, the healthcare professional, they believe that they know best and may withhold information from you and also be really didactic in the way that they communicate with their patient, and also really hinder and limit their choices. Now, if you remember at the start of the year, I'm just going to leave the post here where I talked about how Dr. Chatterjee, in his interview with Jay Shetty, when he talks about his new book, Make Change That Lasts, he talks about how he's very much against this paternalistic approach to speaking with patients and communicating and connecting with them. And that interview is actually what gave me the idea to record this particular video. So I'm just going off of that. Now, on the other hand, maternalism is a more nurturing, now it may sound nurturing, but it is equally controlling, a more controlling approach towards working with your patients. So this is when, as a healthcare professional, you become overly protective. You want to really sort of shield them from everything bad that they may feel or that can possibly happen to them. You may not tell them the truth if something that's difficult for them to really digest and comprehend. And what you really believe in is just putting band-aids on a bigger problem that will just, for the short term, give a quick fix and make the patient feel better, rather than overall what is going to be beneficial for them in the long run. Now, just to make it very clear, both these approaches, they stem from good intentions, and people are coming from a good place when working with their patients. However, this is a very unconscious approach that people tend to undertake. I'm going to tell you this now. I don't know what my mom is like as a doctor with her patients, and I have been told by many people that she's very motherly. But with me, she takes on this very maternalistic approach when I have medical needs. And I can kind of understand because she is my mother. But, does she or has she done that in the past when she has worked with patients? Remains to be seen. But I definitely see that when she is in communication with me about my health. Now, in my case, it's absolutely acceptable because I'm her daughter, she's my mother, so she is allowed to be maternalistic with me. But with her patients, where she has to be a bit more professional, it's a slightly different story. Now, we're now going to go into the different ways in which this paternalistic or maternalistic approach plays out in consultations with patients in real time. So, number one, healthcare providers may make decisions for patients for them as opposed to with them. So, say for example, I remember quite a few years ago when I was in consultation with an endocrinologist and to really deal with a lot of hormonal fluctuations I was having because I was diagnosed with polycystic ovarian syndrome. So at that point, I remember this particular endocrinologist was very pushy that I should take this medical this intervention, so it was like a tablet, which was very similar to the morning after pill, that would regulate my hormone levels. There was no mention by him in terms of changing my diet, changing my lifestyle, and adopting a more holistic approach. So he was very one-track minded that this is the only way in which my hormone levels can be restored. At that point, I have to admit, I felt quite unheard and quite frustrated. I knew that the morning after pill or that medication is going to have a lot of side effects, and he did not even discuss that with me. He just basically shoved it down my throat, saying that this is what I have to do if I want my hormone levels to be back to normal. And lo and behold, unsurprisingly, there were a lot of side effects that I had after taking that medication, to the point that I had to eventually cease it. And I undertook many other different approaches with other healthcare professionals, which restored my hormone levels back to normal without the intervention of that one approach that he completely swore by, and he didn't seem to know any better. So in this situation, when we fully assume control of a patient's healthcare decisions, we strip them away of their autonomy, and that's one thing I talk about on this channel and my content all the time. So patients need to feel like they are participating and they're equally involved in their treatment and care, not just passive recipients of instructions. So, and now let's go on to the second point where this maternalistic or paternalistic approach really plays out. And that is when you can really sugarcoat difficult conversations. Now, this I've observed quite often and quite common amongst therapists. Now, I know that therapists that is their role. They really want to get their patient to or their client to go from point A to point B and equip them with tools and strategies that they can incorporate to learn and become, a much happier, healthier, and more well-rounded person. However, sometimes what I have seen a lot of therapists do is that they will tell the client or the patient what they need to hear. So even if there is somebody who talks about, a very recent loss that they have experienced, so they're going through a grief of some sort, the therapist might just say that this is just a passing phase. It might get better, that it is going to get better. And while that's very good to listen to and hear, they're not actually telling them, the ways in which you go through the 5 stages of grief and you process and accept that before you get to a place of acceptance of that loss or grief that you're experiencing. And when they know that some patients are more, or some clients are more susceptible and sensitive than others, they unconsciously tend to undertake this as well. So they really tend to soften the blow. And sometimes that might be beneficial, and sometimes probably not. And in these situations, what we try to do, the maternalistic approach really, is that we are protecting them from bad news, and that can really do a lot more harm than good. And patients need to receive transparent communication and honest conversations and get the full picture so that they can make more informed decisions about their health and their wellness moving forward. And number 3 is you tend to over-assist patients to the point that it becomes an unhealthily codependent relationship. Now, quite recently, as I mentioned in my LinkedIn content, I had surgery. And now I'm just going to give you two examples. One is a hypothetical scenario, and one is the scenario that I experienced. So I was working with a physical therapist or a physiotherapist who recommended that I do several exercises 3 times a day, every single day after surgery, so that my clavicle and my arm is back onto a functional level. And basically what she did was just give me this list of exercises that I do, and how many reps I need to do it, and she showed me how to do those exercises and make me sort of do it as well. And she also checked in with me after 1 week to see how I'm tracking, if I'm having any problems, and if there's any way in which she can assist. Now, this is what a good physical therapist would do. Now, on the other hand, another physical therapist who is very, very, overbearing, she might just be doing all the exercises for me and actually literally be there and handhold me through the whole process. Now, even though the exercises were very easy to do, but still, she might be in a position, she can say, you need to come to my clinic and I will adjust the seating for you, I will adjust the room for you, and you have to do these exercises in my presence so that I make sure that I'm assured that you are doing the right thing. So, and that is not coming from a bad place. But imagine my situation. I could not drive at the time. I could not do any kind of physical activity. I could not, besides these exercises, I was not allowed to lift anything heavy or do any kind of physical exertion on myself. So in that position, even though another physical therapist may be taking a more kind approach, but I would have felt very stifled and oppressed if I had been in that situation where I have to physically go to her every time and make sure that she is getting the right information in terms of what exercise I'm doing. And in this case, the physical therapist completely trusted my judgment, and she just checked on me after a week later to how it went. And I was very diligent and with my exercises and all the rest of the post-treatment recovery suggestions that I was given, and I was back on my feet in about 2 weeks' time. So in this situation, when we take over tasks that patients can do themselves, or they can do with minimal supervision, you're sending the message that you don't really trust their capability to be able to do something. So this can really erode a patient's confidence and diminish their sense of autonomy. And you really want to make your patients resilient and self-dependent. For them to really take control of the situation moving forward. So these are some of the ways in which a maternalistic or paternalistic approach when working with patients can really go against you as a healthcare professional. And I'm going to look in upcoming videos on how you can turn this around so that you are really equipping and empowering your patients rather than hand-holding them and making them feel oppressed and not being truthful to them or transparent with them just to make them feel better. To stay tuned with the rest of my content, make sure that you hit the subscribe button and the notification bell. And as always, thank you very much for your time, attention, and presence, and I will see you next week.